Hello everyone, welcome back to the Concepts in Clinical Anatomy. In this video, we are going to see why cardiac pain is referred to the limbs, particularly the left upper limb and any other location like pectoral region, lower end of mandible or even up to the level of umbilicus. Heart is the structure which is usually insensitive to touch, even a cut injury or hot or cold, because it is supplied by the autonomic nervous system. But the heart is more sensitive to the injury like ischemia or metabolic product accumulation due to any ischemic causes. So as I already said, this sensitive and insensitivity is mainly due to the sympathetic and parasympathetic fiber which is supplying the heart. But when we see the innervation to the heart, which is broadly divided into superficial cardiac plexus and deep cardiac plexus, both includes the fibers from sympathetic and parasympathetic. Cardiac plexus is divided into superficial and deep. Both sympathetic and parasympathetic fibers are contributing to both the plexus. Superficial cardiac plexus is receiving the sympathetic fiber from the superior cervical branch of left cervical sympathetic chain, and it will also receive the parasympathetic supply from the inferior cervical cardiac branch of left vagus nerve. The location of the superficial cardiac plexus is just below the arch of aorta and in front of the bifurcation of pulmonary trunk and right to the ligamentum arteriosus. Coming to the deep cardiac plexus, which is supplied by the numerous nerves which arises from all the sympathetic ganglion, starting from the superior cervical sympathetic ganglion to the T5 ganglion. From here, the cardiac branches will be contributing to the deeper plexus, that is the sympathetic fiber. Coming to the parasympathetic fiber, will arise from the right and left vagus and also from the recurrent laryngeal nerve. So this, by means of the superficial and deep cardiac plexus, it will supply the whole myocardium of the heart. So if there is any pain stimulus in the myocardium of the heart, the pain fibers will travel along the sympathetic pathway. Then from the ganglion, that is especially from T1 to T5 ganglion, it will be reaching the spinal segment starting from T1 segment to T4 segment usually. Dorsal root ganglion of the T1 to T4 segment has the first order neuron for this pain pathway fibers. From there, it will take the usual pathway of any pain sensation. So the pain sensation which is already carried in these segments, that is from the T1 to T4, is also more fibers that mainly supplies to the pectoral region or the medial aspect of the arm. Because of that, the cardiac pain is usually referred to these dermatomes. So these dermatomes includes the medial border of the arm and the pectoral region. So as I already said, usually the cardiac pain will be referred to the pectoral region and the medial aspect of the arm, because here the medial cutaneous nerve of forearm and the intercostobrachial nerve, which is arising from the T2 to T3, which is also supplying the medial border of the upper limb. So as the heart is located in the left side, so the pain will be usually radiated to the left side of the upper limb in the medial border and the pectoral region. Apart from that, because these fibers can also goes along the cervical, okay, so starting from the lower part of the mandible up to the level of umbilicus, okay, so because of the intercommunicating nerves in this segment, it can able to go to the other side of the pectoral region also. So this explains why there is wide range of distribution of myocardial pain, and this is the most usual type of referred pain. Hope you understood the concept behind the referred pain of the heart. For more related videos, subscribe to our Concepts of Clinical Anatomy YouTube channel. Thank you.